Today I'm going to discuss about rotator cuff tear.
Hi everyone, my name is Zonna. I'm a physical therapist from Orange County, California, and you're watching my channel, Zonna Physical Therapy.
Hello everyone, welcome back to my channel. I am here to help you improve your health to live a good life. Today I'm going to discuss rotator cuff tear. But before that, I want to welcome you, my heart of banana behind me. As you can see, the background there, it's a banana tree, and it is having his moment, and he has a heart right there, and so that's how the banana starts with a flower, and that's how it grows into the actual banana that we eat. I'm gonna show you the banana closer before I end the video. So I hope you enjoyed this video today and you learned something. I'm going to discuss about shoulder pain. Rotator cuff tear is a tear in the tissues connecting the muscles to the bone, or what we call the tendons. This tear occurs around the shoulder joint. Symptoms can include pain and weakness, as well as over time, you develop a limitation of motion on your shoulder. Treatment could include medication, rest, physical therapy, or you could get a corticosteroid injection from your doctor's office, and possibly it could lead to surgery if it doesn't heal and the pain continues to persist. And depending on what kind of activities or hobbies or sports, or even if you use your shoulder a lot for your occupation, then you might end up getting a surgery. Physical therapy visits, they have treatments that could help you with your shoulder. Even occupational therapists could help you with this problem. Another way is to rest the shoulder, especially if you use your shoulder for your occupation where you do a repetitive motion with the same motion over and over time. This could lead to a tear on that tendon. And if you have a really high pain and it continues to persist, where you can't possibly do your activities of your daily living, you have to at least tell the doctor about it. And for the most part, they would advise you to have a corticosteroids injections. And if it gets worse, you could possibly end up getting a surgery done. The conservative way to treat this problem is, of course, ice, rest, and physical therapy. When you go to a physical therapy clinic, they would apply TENS unit. It's an electrical stimulator to decrease pain, as well as use ultrasound if needed. And a lot of ways they give you some shoulder exercises that are safe for that particular tear. It's safe to do for the kind of injury that you have. So make sure you see your physical therapist. What are the common symptoms that you will experience if you possibly have rotator cuff injury? Usually it is painful even if you are resting and even at night, especially if you are sleeping on that side of your shoulder. And also it will be painful when you're lifting and lowering your arm on a specific motion. It is also painful when you are rotating your shoulder, and you will also feel weakness on that shoulder, not like it used to be. As well as sometimes you will hear a crepitus or cracking sound when you are moving. Is it recommended to have a surgery done on your shoulder when you have the tear? Well, it all depends on your occupation. If you need to use your shoulder right away, it might be that you need to consider surgery, because if you are going back to your sports or occupation doing the same thing, it could possibly tear other parts of your shoulder and will make it worse and harder to heal. Most tendon tears is really very difficult to heal on its own, but it could at least go back to a good function. You could possibly use it without surgery. Over time, the pain will decrease, and if you are doing some exercises that are correct for your type of condition and build the muscles around it, then you will possibly go back to your previous activities. But you just have to be very careful, because once you injured it once, it will be easy to re-injure it again. And usually the second time or the third time around you injure the tendon, it will be worse than the first time you damage them. And in some occasions, especially if you're an athlete, most of the doctors might consider doing a surgery. In most cases, if your injury is minor, it should heal in about 2 to 4 weeks. But if it's a severe or chronic injury, usually it would take months to heal. And of course, if the pain is really bothering you and it gets in a way from your daily activities, then most doctors would recommend getting a steroids. And if you don't do anything with your rotator cuff tear, over time, the tear might get bigger and bigger and the damage might get worse. And at the same time, you will still end up having to do surgery. And not only that, it is very painful. You could lose your strength and you will be so weak. And at the same time, you could have limitation of motion. And even so, it could lead as well to frozen shoulder, where your shoulder gets sticky and you will be having hard time to put on your clothes and do other activities that you need daily in your life. And as well as you will have a hard time lifting groceries, bags, and other items that you need. I hope this gives you an idea on what to do when you have a rotator cuff tear and help you with your decision. But please make sure to always consult your medical professionals. This is a general advice. It's always good to see your own doctor and your physical therapist. So that is the banana up there. I am just waiting for it to get ripe so I can eat it. And here is the banana flowers. So amazing to see this. And as well as I have the malunggay tree, so beautiful. And this malunggay, I think in English it's moringa. They're very good for you. That's what actually Manny Pacquiao, the boxer, he makes malunggay or these leaves, you know, he makes it into like a shake, a green drink. And then I have here the guava leaves and guava tree. So beautiful. And then of course my favorite, the fig tree. I always love figs, and yeah, it's in the Bible that you have to eat olives and figs. I love olives and I love figs, and I'm so grateful that I have them. I don't have to buy it from the grocery. So that is it for my short video today, and I hope you learned something from it and you could share it to someone you know that could possibly benefit with this advice. I hope you're staying safe and happy out there. Thank you so much again for watching, and I'll see you on my next one. My name is Zonna, physical therapist from Orange County, California. I am here to help you improve your health to live a good life.